The question, is fibromyalgia a distinct disease or an amalgamation of several symptoms of other conditions? Leslie Crofford, MD, began by asking the audience, if fibromyalgia is disease, what is the role of rheumatologists in the diagnosis and management of patients with fibromyalgia? Crofford said that a disease is any abnormal condition that impairs bodily function and is associated with specific symptoms or signs. She asked, do you need to have a cause to have a disease? And pointed to several chronic diseases with no known cause, including the aforementioned autoimmune inflammatory diseases. Other questions to consider as part of this slippery process of naming a disease: when does a patient have a disease that needs to be acknowledged? Who decides and why? Videos and guide, Overcome Fibromyalgia, Fibromyalgia 2. She said that, whatever their flaws, the ACR criteria for fibromyalgia identify a discrete group of patients, and that patients meeting ACR criteria for fibromyalgia exist on a spectrum regarding symptom domains, heavily weighted to psychological distress, coping issues. She also identified 3 key categories of information to consider. Treatment. Developing a treatment plan requires that the patient have a conceptual framework of their condition, the first step of which is being able to put a name to the cause of their affliction. Most patients seem to do better with non-pharmacologic treatments in which they can participate, the self-actualizing patient. Patients treated with pharmacologic interventions tend to do better when treatments address central rather than peripheral targets. In closing, she said clinicians should remember that whatever their position is in the disease/not a disease debate, they need to be aware that their patients have symptoms that adversely affect their quality of life and/or function, and they deserve thoughtful consideration. While acknowledging the abilities of primary care physicians and other healthcare professionals to treat patients with fibromyalgia, Crofford said the rheumatologists are uniquely trained and qualified to evaluate these patients, provide the best information, and devise the most effective treatment plan that meets the unique needs of each individual patient. I'm not sure would be much help to a FMS/CFS expert and sacred cellular healing health practitioner who discovered and developed a proprietary brand of energy healing she calls Sacred Cellular Healing, SCH, that works for many illnesses such as fibromyalgia, chronic fatigue syndrome and autoimmune illnesses. Dear Nuclear Fire, I thought I keep reading on Kevin. MD that Therese no such thing as easy money for docs. Sorry, you're not that funny and I agree with Cinda. Crofford said the rheumatologists are uniquely trained and qualified to evaluate these patients, provide the best information, and devise the most effective treatment plan that meets the unique needs of each individual patient. Check out the link below for a guide on long-term remission or to join in with the community.